Welcome to PCR London Valves 2024. I am Hélène Eltchaninoff from Rouen in France, and I have the pleasure to be with Hendrik Treede from a university center in Mainz. So we'll discuss about intervention in women, because I think there is an issue. Women are less represented in a randomized trial. We have data suggesting that they have worse results with surgery and better outcome with TAVR than men. So as a surgeon, do you have explanation on that issue of intervention in women?
Yeah, the first thing that comes to my mind is that women usually tend to have smaller annuli. And then when they enter surgery and the surgeons implant very small valves, then there's a natural bias towards worse outcome in women. This is my first guess. It may have also something to do that the type of myocardial changes in aortic stenosis in women is a bit different from men, so there's more fibrosis. Maybe even that plays a role when it comes to surgery compared to TAVR. But my first guess would be the annulus size.
That's why, in fact, there was this large trial, REA, conducted in women.
The REA trial was a very important trial, and I congratulated you for doing it, comparing TAVR versus TAVR in an only woman population. And what we learned from the trial is that the combined endpoint of death, stroke, and rehospitalization was much in favor for TAVR. Fortunately enough, it was only driven by rehospitalization, so there was no difference in stroke or in death, but it was quite obvious that there was a better result when it comes to TAVR. So that was a major finding. But of course, it's always important to also critically look at the underlying data. And I see some points where surgery could potentially have had better outcome with better techniques, for example. Is that also your opinion if you look at the surgical arm of REA?
Yes, I think what we can say that in both groups, results were really excellent, both clinical endpoints and hemodynamic results, and it's very impressive. That's true that it was a little surprising to see that in the surgical group with experienced centers there was no aortic root enlargement, which is a kind of surprise when you are talking about small valves. So I know that you are very experienced in that, and probably they should change or try to change to at least to favor the longer outcome in this population with small annuli. It's probably important. So I think we can summarize all of that. We can say that it is an issue, which is the best intervention in a woman between a TAVR and surgery. We have this result of this large trial favoring TAVR, but it's driven by rehospitalization. We have both excellent results in the two groups, but that's true that I think we should probably try to improve the strategies in the surgical group, and maybe it could improve everyone. I mean, the woman will have a better result because some women will not be able to get TAVR because of their anatomical features, so they will go to surgery. So all of us have to improve and to reach the best outcome in this population.
For sure, and it all starts out with doing CT scans in everyone, because then you know when there is a small annulus, and then you can guide your treatment by looking at the images. This will be the very first step for surgeons to change, and then they have to learn to do root enlargement to achieve the best possible outcome.
So thank you very much, Hendrik.
You're very welcome, Hélène.